Hello guys, welcome to Metier International Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS, NCLEX and OET training. And welcome back to Magic Pill session. As usual in Magic Pill session, we are discussing very important MCQs and additional golden points. And today also we are going to start with a very important topic based upon the demand of the students. Most of the students asked about defibrillator and cardioversion types, indication, and joules. Each and everything we are going to cover in this session. So watch the video till the end. Definitely it will be so much useful for you. Let's move on to the session. Let's start with, as usual, thought of the day. Stay optimistic means stay positive. Every new day offers an opportunity to improve. Okay, it's a self-defining thought. So be optimistic, stay positive all the time. Okay, so with this thought, let's start the session. So as I mentioned already, we are going to discuss all the important questions so far as related to defibrillator and cardioversion. Not only that, we are going to cover the vital golden points related to defibrillator and cardioversion. So watch the video till the end. And if you like the video, please like it, share it, and subscribe our channel. If you have any doubt anywhere, drop your message in the comment section. So this feature is very, very familiar, guys. Okay. So even when I was wrote the exam, competitive exam, I used to study with the image like this. Okay. So this image is very famous. So cardioversion and defibrillator in a single glance, if you see, means immediately we will get the idea what is cardioversion and what is defibrillator. So let's go with this image. First, let's start with the defibrillator. So defibrillator, when we will use the defibrillator in the emergency situation. And what is the indication for using the defibrillator? Whenever the patient is suffering from ventricular fibrillation or ventricular tachycardia, that is pulseless ventricular tachycardia, only in these two conditions, we have to use the defibrillator. Okay, ventricular fibrillation and pulseless ventricular tachycardia means there will not be any pulse. Okay, fine. So what type of joules, how much joules we have to give during the defibrillator? It depends upon monophasic, biphasic. We will discuss that later. But at present, please keep this in mind. We can go up to 360 joules. 200 to 360 joules we can give in the defibrillator. Right? Make sure that here the patient is always unconscious. Okay, so these are all the vital points you're supposed to keep in mind. And in compared to cardioversion, on other and cardioversion is there. You can see here the patient is unconscious, whereas here the patient is conscious. It is an elective procedure. Okay, it is an elective procedure. Here the patient is awake and we have to sedate the patient and then we have to start with the cardioversion. See, cardioversion means we are giving the shock. That shock is going to be synchronized with the ECG waves, especially R wave. Okay, so that is called as synchronization. Whenever the R waves come, that time we are going to deliver the shock. Okay, so it is an elective procedure. Here we can use the joules 50 to 200 joules. And here, before doing the procedure, we are going to take the consent form. So these are all the basics of cardioversion and defibrillator. Okay, let's go in detail about defibrillator first, and then we can go with the cardioversion. So defibrillator, the types of defibrillator is very important for your exams. Okay, previously we have seen few things. All the point whatever we have discussed in this slide is very, very vital point, basics of defibrillator and cardioversion. Okay, so now we are going to start with the defibrillator types. See, two types of the defibrillator is there, guys. That is biphasic defibrillator and monophasic defibrillator. You can see very clearly this is the defibrillator. One more important point, there is no separate machine for cardioversion. Defibrillator machine, it will do dual function. One as a defibrillator, another like a cardioversion. So the same defibrillator machine, it will act like a defibrillator as well as the cardioversion. Please remember that. Okay, fine. So now we are talking about defibrillator. Two types of defibrillator modes are there. The first one is monophasic and second one is biphasic. Monophasic, previously we are using very commonly, but nowadays we are not using monophasic because the myocardial injury is very common in monophasic because we are delivering high joules. Okay, high joules of current we are delivering in the myocardium. So myocardial injury is very common. So nowadays we are not using that. Instead of that, we are using biphasic. Okay, fine. So let's see what is the difference between these two things. In this image, you can see very clearly, this is the monophasic. So the current, that is the joules of current, whatever you are delivering, it is going to travel from one area to another area. Only one movement will be there. Only one movement will be there. That is called as what? Monophasic. Okay. Whereas in biphasic, the current is going to travel like this, from here to here and from here to here, like a cycle, right? So this is called as what? Biphasic. So two times there is a traveling of the current from here to here and then again from here to here, right? So this is called as what? Biphasic. Okay, let's see. This is the image based clarification about the monophasic and biphasic. Now we can see the difference between monophasic and biphasic, NORCET point of view, vital point of view. Okay, so you can see the first one is monophasic defibrillator, and here you can see the biphasic defibrillator. Here the waveforms already I have mentioned about the waveforms. The current flows in one direction only. You can see here the current flows in one direction only. That is called as what? Monophasic defibrillator. Whereas here biphasic defibrillator, current flows in two directions, from here to here, from ear to ear. So two direction. Energy requirement, very important, repeatedly asked question. Energy requirement for monophasic and biphasic defibrillator. For monophasic defibrillator, the energy requirement is very higher. That is, we have to use up to 360 joules. Okay, so because of higher joules, what is happening? Myocardial damage, more likely causing the myocardial damage because of higher energy we are delivering in the monophasic defibrillator. That's why nowadays we are not using it. Okay, whereas here you can see in biphasic defibrillator only we are using 120 to 200 joules. It is a minimum amount of joules. So here less myocardial injury. Obviously here also myocardial injury is there, but less. Okay, which is more effective, monophasic and or biphasic? Obviously less myocardial injury. So biphasic defibrillator is more effective. Okay, so shock settings here, standard fixed dose we are delivering in monophasic defibrillator, that is 360 joules. Very important question. Whereas here biphasic defibrillator, it is an adjustable setting, that is we can deliver from 120 to 200 joules. Okay, so it depends upon the doctor's order. So this is the basic difference between the monophasic defibrillator and biphasic defibrillator. So image based question, and these differences are very, very important for your exams. Okay, fine. So now we are going to start with types of defibrillator. Previously, we have discussed about what modes, two modes, that is monophasic and biphasic. Now we are going to start with what? Types of defibrillator. Again, this is also very important for your exams. See, the first type is manual defibrillator. Manual defibrillator means this is the manual defibrillator. Okay, a big machine will be there. Manually we have to carry it and we have to adjust the joules and then we have to deliver the shock to the patient. This is called as what? Manual defibrillator. And second one is automated external defibrillator. See, it is like a compact machine. We can fold and keep it in the pocket. Okay, and whenever there is a chance to charge it, we have to charge, and then in the emergency situation we have to deliver the charge, deliver the joules to the patient. Okay, so that is automated external defibrillator. Okay, so it is same like manual defibrillator, but it is compact. That's it. Okay, fine. Two pads will be there, and just we have to stick over the chest and the abdomen. Means not in the abdomen, in the fifth intercostal space, and then we have to deliver the charge according to the doctor's order. Okay, so these are all the two things. And third one is implantable cardioverter defibrillator. Very important, related to this one, already question asked in the exams. Okay, implantable cardioverter defibrillator. It means you know about pacemaker, right? So pacemaker, where they will implant subcutaneous, right? So here also implantable cardioverter defibrillator, they will be implant inside the body, and it will monitor the heart rate continuously 24/7. Okay, and if there is any changes in the heart rate because of arrhythmias like atrial fibrillation, atrial flutter, in all these conditions, immediately this implantable cardioversion defibrillator analyze the rhythm of the heart and it will try to correct the heart rhythms. Okay, it tries to correct the heart rhythms. Okay, so this is the function of what? Implantable cardioversion defibrillator. The last one is wearable defibrillator. It is another version of implantable cardioversion defibrillator. Here we are going to keep the defibrillator outside the body, not inside. That is the only difference. Okay, fine. See, one mnemonic always please keep in mind, guys, related to defibrillator, DEFIB, defib. What is that? Whenever the patient is going for collapse, that is especially ventricular fibrillation and pulseless ventricular tachycardia, defibrillate means keep the defibrillator ready and check the rhythm, place the pad, and you all know that you clear, I clear, all clear, that rhythm. and last start with the CPR, and then we have to deliver the shock. Okay, so this is the mnemonic called as defib. Okay, fine. So these are all the important MCQ points. Please remember that. Now we can go and solve the question. So these are all the basics about defib. So we have covered the basics about defib. Now we are going to start to solve the questions. Okay, let's go with the question. A 58-year-old male collapsed in the emergency room and the cardiac monitor shows a chaotic irregular waveform. So always whenever you are reading any type of questions, please note the key points. Okay, so here you can see the cardiac monitor shows a chaotic irregular waveform with no sustainable QRS complex. That chaotic word is very important. Okay, chaotic means irregular waveforms. We cannot predict what is happening in the rhythm. Okay, so that is called as what? Chaotic waveform. Okay, so here the patient is unresponsive and there is no pulse and there is no breathing at all. So pulse is not there and there is no breathing at all. Patient is also unresponsive. See, this kind of pattern in which arrhythmias you can see, you have to find out that first. Based upon that only, we have to solve the question. So let's see what are the options they have given here. Start synchronized cardioversion, start CPR and prepare for defibrillator, administer amiodarone IV push, give oxygen via mask and monitor ECG. Okay, so these are all the options they are given here. First, we need to find out this chaotic irregular waveform with there is no identifiable QRS complex, patient is unresponsive, there is no pulse, very important vital point, and the patient is also not breathing. This kind of characteristic is seen in which ECG rhythm? And the right answer is ventricular fibrillation. You can see here very clearly, this is called as what? Chaotic waveforms. There is no proper P, Q, or S, T complex. Okay, so if the waves are abnormal, it is totally irregular. Okay, so if the waves are abnormal, it denotes that the ventricles are vibrating. Okay, that is called as what? Ventricular fibrillation. The contraction power of the ventricle is not complete. Okay, instead of contracting, it is vibrating. That is called as ventricular fibrillation. So cardiac output is decreased. Okay, that's why there is no pulse. Okay, so if you are seeing any type of waves like this in the exams, in the questions, so it shows that the patient is suffering from ventricular fibrillation because the waves are chaotic. In this type of waves, the cardiac output will not be there, so there is no pulse at all. Okay, so in case of ventricular fibrillation, what type of thing we supposed to use, whether we need to use defibrillator or cardioversion? Obviously, for ventricular fibrillation and pulseless ventricular tachycardia, it is standard. We have to use only defibrillation. Okay, so here you can see the rationale very clearly, guys. The patient is in ventricular fibrillation. There is no pulse, no breathing. There is no organized electrical activity. That is chaotic electrical activity. In this situation, don't think about the cardioversion. You have to go with the CPR and then defibrillation. Always, if the patient is collapsing, first you have to start with the CPR. Okay, if the patient is unconscious, patient is collapsing, there is no pulse, there is no carotid pulse, go with the CPR, and another person should prepare the defibrillator and you have to give the shock. Okay, so this is all about the thing. So in this question, the key point is chaotic irregular waves and no pulse. That's why we have understood that the patient is suffering from ventricular fibrillation. So we have selected option B as a right one. Start with the CPR and prefer giving the defibrillator. So which is the right answer here? Option B is the right answer here. Clear with the concept, guys? Okay, so find out the key point: chaotic, unresponsive, no pulse. Immediately think about ventricular fibrillation. In case of ventricular fibrillation, we have to use the defibrillator, but before using the defibrillator, we have to start with the CPR. That's why we selected with option B. That's it. Next. Question number 2. So answer already there, no issues. See, the patient with the atrial fibrillation complains of palpitation. So atrial fibrillation is the first key point. Okay, palpitation, shortness of breath, all those things are there. ECG confirms atrial fibrillation. Directly they have said that atrial fibrillation is present. Ventricular rate is 140 beats per minute. Usually atrial fibrillation, the atrial beats will be more than 350 to 600. It will be in between that. Heart rate, that is especially if you are taking atrium rate or atrium beats, it will be more than 350. It will come up to 600. Okay, and based upon the atrial rate, the ventricular rate will also increase. So here they have mentioned the ventricular rate 140. It is higher rate. Okay, so 120 to 160 ventricular rate also denotes the patient is having what? Atrial fibrillation. Okay, fine. So on the whole, first we got the diagnosis that this patient is suffering from atrial fibrillation, but fortunately the patient blood pressure is almost normal. 130 by 80 mm of mercury is normal, and the patient is also conscious. What is the expected intervention here? Okay, so this is the question. So immediately defibrillate. See, atrial fibrillation, we should never think about defibrillation. We should never think about defibrillation. Only two conditions we have to think about defibrillation. You know that ventricular fibrillation and pulses, ventricular tachycardia. Here, atrial fibrillation is going on. So don't think about the defibrillation. Second option is synchronized cardioversion after sedation. Yes, obviously, that is the answer, because in atrial fibrillation and even atrial flutter, atrial flutter is one of the supraventricular tachycardia. Okay, fine. So in this condition, what we supposed to do? We have to think about cardioversion only. Okay. So unsynchronized cardioversion is almost same like defibrillation. Don't think about that. Start CPR immediately. We have to, the patient is conscious. Why we need to start the CPR? Why we need to start the CPR? The patient is conscious, right? So no need to start with the CPR. The BP is okay. The patient is conscious. Only the ventricular rate is increased up to 140, right? And already diagnosed that atrial fibrillation is present. So in this condition, we have to go with the elective procedure that is called as what? Cardioversion. Synchronized cardioversion after sedation, after taking consent from the patient, we have to do the synchronized cardioversion. Clear with the concept, guys? Yes? Fine. So you can see here, this is called as atrial fibrillation. I will clearly explain about what is atrial fibrillation, what is atrial flutter. I'm going to compare these two things because that is very important for your upcoming competitive exam. Previously, many times they have asked the question. See, you can see in this ECG rhythm, QRS complex is narrow, it is regular. QRS complex is, means here it is regular, sometimes 3:1 ratio or 2:1 ratio. It is, means the rhythm is present, right? But in some rhythm, the wider angle is present, and some rhythm it is normal. So here you can see the normal QRS complex. Here also you can see the normal QRS complex. Okay, but whether you can see the P waves, that is the question. Whether we can see the P waves, you cannot see the P waves here. Okay, whether the P waves are means hidden in the QRS complex, or P waves are irregular. Okay, so there is no normal P waves at all. It shows that the patient is suffering from atrial fibrillation. In atrial flutter, sawtooth-shaped waves will be present. That is the key point. That is the key point. Whereas in atrial fibrillation, irregular P waves. There is no P waves at all. You cannot see the P waves. Only QRS complex is present. Right? So if you are getting rhythm like this, you can directly go for what? Atrial fibrillation. Atrial fibrillation. Okay, up to 350 to 600 beats, atrial beats will be present. Okay, guys, fine. So you can see the next question here. A 62-year-old male patient develops ventricular fibrillation in ICU. So the patient is already admitted in the ICU and ventricular fibrillation develops. The defibrillator is set up. Ventricular fibrillation means definitely we will use the defibrillation. What is the recommended initial dose of biphasic defibrillator? This is how the exam questions will be there. Okay, monophasic defibrillator or biphasic defibrillator, they will be specifying the key point. Okay, so you have to smart enough to answer it. Okay, so initial dose they are asking here in the biphasic defibrillator. So 4 options they have given here: 50 joules, 100 joules, 150 to 200 joules, 360 joules, and right answer here is option C, that is 150 to 200 joules. Okay, they will start with 150 joules. Okay, guys, some books says 120 joules. But okay, but here 122 joules option is not there. So that's why we are going with what? 150 to 200 joules. Okay, so the rationale is if you are using the biphasic defibrillator, 150 to 200 joules for ventricular fibrillation and pulseless ventricular tachycardia, we can give. Okay, and what about in monophasic? Instead of biphasic defibrillation, if they are mentioning monophasic defibrillation, what is the dosage? Standard dosage, that is 360 joules. It is a standard dosage. Okay, guys, fine. So already I told that in biphasic defibrillator, myocardial injury is less, whereas in monophasic, it is very high. Okay, so this is the initial dosage of biphasic and monophasic defibrillator. Hope you got my point. And the fourth question, a 58-year-old conscious patient with atrial fibrillation, rapid ventricular rate is being prepared for elective synchronized cardioversion. Atrial fibrillation is the first key point. Because of atrial fibrillation and high ventricular rate, I already said that the ventricular rate will be going up to 120 to 160. It is very high here, right? So in that condition, obviously atrial fibrillation, we have to go with the synchronized cardioversion. What is the recommended initial energy dose for cardioversion with biphasic defibrillator? In the previous question, we have discussed about the initial dose for biphasic defibrillator, whereas here they are asking about the cardioversion initial dose they are asking. Okay, see, this point also already I have explained to you. Machine is only one. Defibrillator machine is the one who is going to act as a defibrillator, who is going to act as a cardioversion. Okay, only the mode we are going to adjust. Defibrillator machine will also act like a cardioversion. So here the question here is, cardioversion is planned. What is the initial dosage for cardioversion? This is the question. Okay, for confusing you, they are giving the word biphasic defibrillator. All the questions what we are discussing, it is all taken from the previous year question paper only, guys. Okay, so here the thing is cardioversion, biphasic mode, initial dosage. 20 joules, 50 to 100 joules, 150 to 200 joules, or 360 joules. So here the right answer is going to be what? Cardioversion means the initial beginning dosage is 50 to 100 joules only. 50 to 100 joules only. Clear with the concept? Yes. You can see here for synchronized cardioversion in atrial fibrillation, the initial energy what we can use is 50 to 100 joules. The energies are very, very important. The joules what we are delivering to the patient in each condition, indications, that is very, very important, guys. Okay. So in case of atrial fibrillation, 50 to 100 joules we can use, whereas in atrial flutter already I said that it is a type of supraventricular tachycardia. In that time, 50 joules may be sufficient. Okay, while atrial flutter often sometimes they can go up to 100 joules also. Okay, see, at present you just remember that 50 to 100 joules for atrial fibrillation as well as for atrial flutter. Okay, for both 50 to 100 joules, please remember that. Okay, fine. So it is for biphasic cardioversion. If they are using for monophasic cardioversion, the higher dose what they can use is 100 to 200 joules. Biphasic cardioversion, the joule is 50 to 100, whereas for monophasic cardioversion, 100 to 200 joules. Okay, guys. Next. Now we are going to see the difference between monophasic cardioversion and biphasic cardioversion. Previously, we have seen the difference between the biphasic defibrillator and monophasic defibrillator, but now this is the time to see the difference between monophasic cardioversion and biphasic cardioversion. You can see the difference. Current direction, same. One way, two way. Same like defibrillator. Energy required. Here there is a changes important for your exams. Here in monophasic, how much energy is required? Up to 200. Whereas here 50 to 120 joules used for biphasic cardioversion. This second point is very vital for your exams, guys. Okay. So effectiveness, you know that monophasic is less effective and this one is more effective. And myocardial damage is very common in monophasic cardioversion, whereas less in biphasic cardioversion. Okay. So these things are important vital points. Okay. Next. What is this, guys? By seeing immediately, you have to say that this is atrial flutter. How I am saying it is atrial flutter? Not by the words which is already mentioned here, by the rhythm, what I am seeing here. It is a sawtooth shaped rhythm I am seeing here. So immediately I can say that it is a atrial flutter. Okay, image-based questions are very common. ECG questions are very common in the exams. So make sure that you are answering that. Okay, so sawtooth shaped regular waves are present. Okay, so in that condition, we can go with the word called as what? Atrial flutter. Okay, fine. See, this slide is very important, guys. I'm going to compare atrial fibrillation with atrial flutter. Please focus. Okay, so atrial fibrillation and atrial flutter, both are coming under what? Supraventricular tachycardia. Okay, what is supraventricular tachycardia? Above the AV node, if the abnormal arrhythmias are present, that is called as what? Supraventricular tachycardia. Fine. So, okay. So first, let's see about the atrial fibrillation. Here, the rhythm is irregular. I have already shown the image. P waves is, there is no P waves at all. Chaotic, irregular waves will be present. Only QRS complex will be normal in the atrial fibrillation. Okay. So, irregular waves means irregular means worst waves. Atrial flutter, you can see regular and irregular waves. Both will be present. Whereas here, only irregular. But here, regular or irregular, that is sawtooth shape. Okay. Atrial rate, very important, repeatedly asked question, 350 to 600 beats per minute. Whereas here 250 to 350 beats per minute. Average is 300 beats per minute. Okay. P waves in both the condition, P waves are absent. Okay. And here ventricular response in atrial fibrillation, QRS, sometimes it will be irregular. Whereas here in atrial flutter, it is regular. In atrial fibrillation image, please go back and see that QRS complex, there will be sometime it will be regular, sometime it will be irregular. Okay, the time duration. Whereas in atrial flutter, the time duration also regular in the QRS complex. Okay, and ECG appearance, already I said that no P waves, chaotic baseline. Chaotic appearance means irregular. Whereas here atrial flutter, sawtooth shape will be present. Okay, next. Question number 5. A 6-year-old child collapse. This is based upon the pediatric PALS, pediatric advanced life support. I'm going to discuss this question. So 6-year-old child collapse and is found in the ventricular fibrillation. Here also ventricular fibrillation, we are going to use the defibrillator only. What is the recommended initial shock dose for defibrillator in children's? We are asking in children's, right? So definitely the dosage is going to be changed for adult as well as for children's, because for children's they are going to calculate the joules based upon the weight. Very important question, guys. Weight of the children's. Okay, the dose, the joules which we are going to deliver to the kids, it is going to be calculated based upon the weight of the children's. Weight is the important key point. Okay, so here ventricular fibrillation, first key point. Second key point, defibrillator we are going to use. So they are asking about the dosage. 1 joules per kg, 2 joules per kg, 4 joules or 5 joules per kg. And here the right answer is going to be option B, 2 joules per kg. Okay, 6-year-old child, okay, collapse and is found ventricular fibrillation. What is the initial? So initial, we can start with 2 joules. Initial shock dosage, we can start with what? 2 joules. So according to the pediatric advanced life support, there is PALS. Initial defibrillation dose is 2 joules per kg. If here, suppose here they have mentioned the weight of the child, then we need to calculate. Okay, so 2 joules per 1 kg. If the weight is 5 kg, means 10 joules we supposed to give. 10 is the maximum joules. Okay, so like that we have to calculate and give. But here they doesn't mention any weight. Simply they have mentioned initial shock dosage for a 6-year-old child. Only age they have given. So that's why we are going with what? The initial defibrillation dosage is 2 joules. Suppose it is unsuccessful. Subsequent dosage we can give up to 4 joules, and the maximum dosage like what we can give is 10 joules. Mostly we will not go with the adult joules. Okay, adult dose we will not go. But sometimes if the doctor's orders, we have to go with that. But that also minimum joules they will go, like, up to 30 or 40. Okay. But according to PALS, that is pediatric advanced life support, the maximum joules what we can use for the children's is 10. Minimum initial dosage is 2. 2 is minimum, maximum is 10. Okay, fine. Next. So it is a summary of the topic what we have discussed today. So again, this summary is totally based upon the exams what you're going to appear in the future. So very important, every 1, 2, 3, 4, 5 vital points are going to be mentioned here. Please listen carefully. See, VF or pulseless VT, we have to use the defibrillation. Okay, and the joules energy what we are going to use is 150 to 200 joules in biphasic. So first vital point is over. Second point, atrial fibrillation is there, means we have to use cardioversion. Atrial flutter, we have to use cardioversion. And one more important thing, ventricular tachycardia with pulse. With pulse, underline the key point, with pulse. Okay, without pulse, we have to go with the defibrillator. With pulse, we have to go with the cardioversion. Okay, and ventricular fibrillation for pediatric, again we have to go with what? Defibrillator. Please note down the joules. VF and pulseless VT 150 to 200, atrial fibrillation 50 to 100, atrial flutter 50 joules, VT with pulse 100 joules, and VF, the initial starting dose is 2 joules per kg. Okay, so this is all about the defibrillator and cardioversion, important MCQ point. And one more additional point I would like to add related to Metier Academy. See, we are providing continuous training for students who are going to appear for upcoming examination. You know that nearly 4 examination is on the floor. NORCET examination, JIPMER, PGI, and here Ayush, under Ministry of Ayush. Here Central Government Hospital is there in the Delhi. They also announced the exam. So almost 4 exams is going to be their competitive exams. So more than 600 vacancies all around, more than 600 vacancies you can expect. So please appear in all the exam. And if you want training, proper training, and if you want to clear the exam in the first attempt, please come and join the Metier Academy. And we are always there to help the students. So as early as possible, join and clear the exam in the first attempt. And if you have any doubts anywhere, in joining the Metier Academy, the numbers are mentioned here. You just contact this number. If you are from Delhi or from Pondicherry or from any other states, all over India, online students are studying in Metier Academy. And we are running the offline batches in Delhi as well as in Pondicherry. So you can feel free to contact this number and join and clear the exam in the first attempt. And related to this session, if you're having any doubts anywhere, you can drop your message in the chat box, guys. And thank you. All the best for your upcoming examination.